Hi, you're watching Hindustan Times in Focus, and with me, Aditi Prasad. I have with me the Uttar Pradesh Cabinet Minister Sidharth Nath Singh to answer some critical questions on the Yogi Adityanath's administration's response to the COVID-19 pandemic in Uttar Pradesh. We all know that UP, India's most populous state, is fast emerging as a COVID-19 hotspot in the country, and it's facing a lot of criticism from opposition, from independent observers over alleged underreporting of cases and the healthcare system struggling to cope with with the rising numbers. In the latest, Union Minister and BJP MP Santosh Gangwar has complained in a letter to the Chief Minister that the officials of the health department in Bareilly are not picking up the phones of patients in attendance. And while that may just be the tip of the iceberg, he's really not alone. Just 2 days ago, BJP's Lok Sabha member from Kanpur, Satyadev Pachauri, had written a letter to the Uttar Pradesh Chief Minister mentioning that COVID-19 patients were not getting good treatment and many of them were losing lives outside their homes, outside hospitals, even in ambulances in Kanpur. Now, sir, do you agree that the state's health infrastructure is unable to cope with the rising number of cases?
Certainly don't agree there that we have not been able to cope up. Yes, there have been crises. I will not deny that there have been crises, which has been throughout the country, maybe outside the country also. But let's talk about Uttar Pradesh. Therefore I'm sitting with you. But the challenges have been very, very severe, as severe as I would say the crisis coming on all of us. And we have tried to evolve and face these challenges to improve the system. And we have been doing this from COVID-1 experience till COVID-2 has come. But the proportions have been phenomenally high. I do understand they all are good colleagues of mine. And so sometimes it's an emotional outburst, I'll say, that they like to pen it down and then write to the chief minister. There's nothing wrong in democracy to write to a chief minister or to speak to a chief minister. But I do feel, and that's my personal opinion, that we are a part of a system who has to face the challenge and the crisis and resolve them. We can't be part of the criticism. That's not the way we will, shirk our responsibility. That is like confusing those whom we are here to serve. Oh, humne to kar diya. That can't be the answer by the politicians. None of us, whether in ruling, particularly in the ruling or in the opposition. So therefore, we need to be more responsible. We are part of the system. If there is anything, the system has elected in democratic process, the chief minister and the government. We must be able to go and speak to them and say, yes, this needs to be improved. This is how you can improve. I'm sure the senior politicians which you are referring and many more could be there. We all are capable of arranging things in our life. We are capable of giving. For example, we all MLAs have been able to give 1 crore of rupees or maybe even 3 crores of rupees to our MLA funds or MP funds. If there is a crisis in the constituency that I come through, that is Prayagraj, then that money should be, I will say, okay, the oxygen concentrator should be brought. That's the solution. So I'll just say that
you've responded to the question about the letters being written to the chief minister, but you've not really responded to the content of those letters. The letters
I'll come
talking about, yeah. So please, yeah, can we? I understand your point that everyone is part of the system and we need to work towards that. Absolutely.
Okay. Now let me answer. We had COVID-1. And certainly UP was praised, not only within the country, but even by WHO and many other, world over it was praised. And we realized that there is a problem and this infrastructure needs to be ramped up along with the human resources. Now, what we did in last 1 year, we increased our number of beds by 3 times. For example, we have different gradings, which is L1, L2, L3. L1 is mostly where you don't need the oxygen. So certainly they are graded as L1 beds. Now, L2 is one where you need to be oxygenated beds, and then L3 is where it's a very critical. So between L1, L2, L3, we increased by more than 35% beds, and across all the levels. And that is one thing. We actually, within a year, we actually brought a oxygen plant in Uttar Pradesh near Meerut, which is of inox. That's part of the investment process which I followed through as an investment minister. Now, then we trained more than 70 to 80,000 health workers, particularly looking at non-communicable disease. Now, this is an exercise which we had already done for the fighting the JE and AES battle in Uttar Pradesh. And under that program, we are now very successful state in almost eradicating JE and AES. So we replicated that model and brought it here also. So similarly, we created a cold chain because vaccination program has to be done. So all these things were put in order. Now, what really happens is something comes in and faces us and challenges us of a magnitude which we were certainly not prepared of. And therefore, we had to take that challenge and ramp up our infrastructure as quickly as possible. So, in last month and a half, so L1 beds which we had, which is almost about 1,15,000, we ramped up more than 22,000 as oxygenated beds. Apart from putting up more facilities in Lucknow and Varanasi through DRDO
But
and
the
other,
fact, yeah, fair enough, sir. I get your point that there was a lot of preparation done, but the fact remains that still it's not what needs to be or what's the expected capacity should have been.
Now,
So, as
who
you
will
pointed
define
out,
that?
you were like the entire country, we were caught unawares.
Aditi, who will point out that that is the capacity that needed to be handle this kind of thing? Nobody. Anybody had given that indication? So what we did was, what we faced in COVID-1, we said, no, let's have 2 to 3 times more. And we did that. So I'm not saying that this is good enough that we can say, oh, we did our job and that's it. No, we could not anticipate this kind of a problem. And let's be honest about it. No one could anticipate about it. So therefore, we face this crisis not only in Uttar Pradesh, but rest of, but from where we started off almost in March, end of March, and now where we are, I'm happy to say that we were reporting active cases of 3.5 lakh per day. Now we have come to 2 lakh 20,000 because we took many steps. And I would love to share with you, if given an opportunity, the steps that we have taken during not only on the infrastructure but for testing and treatment. So I'll like to share with you if I get that opportunity.
I just give me a moment, sir, and I will come to that. What steps you've taken, and you will be given an opportunity to list out what steps the government has taken. But I want to talk about in the same breath that I've talked about, the complaints from various leaders and MPs and MLAs of your own party. We've seen the fight for oxygen play out in several states, and you talked about oxygen, and hence I'm asking this question. Several MLAs and leaders from your own party have spoken about the lack of critical medical supplies, especially oxygen, in their respective constituencies and areas. I think the Lakhimpur Kheri MLA had written to the chief minister about that. Do you believe that the government has been and not just you, I mean, it's every state government which is facing the oxygen crisis, including Delhi. Has the government been caught napping with regard to inadequate medical oxygen availability in the state? And I'm asking this question because you talked about the oxygen preparedness that you had, you've made medical oxygen preparedness for your state.
On the face of it, let's be honest about it. Yes, there has been a oxygen shortage to come through, but then let's understand from a different angle also. We were requiring 300 metric tons. UP was intake was 300 metric tons. Now, as of yesterday, we have actually supplied 1,000 metric tons. Now, to go to this kind of a large, which is more than 3 times again in a month, to manage that, you need to understand there is a whole lot of supply chain that needs to be brought in. We were using 30 only, transport vehicles for the oxygen. Okay, so now we are using 90, 60 added within that, and now in order to look at the phase 3, if it comes through and it happens as being spoken in the circles, then we have already ordered, we have taken a global tender out so that we can buy more and keep it with ourselves. In that case, if we need more oxygen, all our oxygens, all our hospitals, more than 100 bed are now going to be, they'll have their own oxygen separators. Not only this, we have 822 community health center. That's for the rural belt. All of them are being provided. Some of them have been, some are in the process, but it's being done. That is, we are now giving them 20 each oxygen concentrators to all of them. The reason is, if it happens in the rural, the nearest thing is to take them to the community health center and give them a relief, and then from there to move them to L2 or L3 hospital. So,
right. So, but don't you
this
think,
is the
sir,
kind
it's
of
a little,
activity we are doing.
which is great, coming now. But do you believe that you could have done this a little sooner? Isn't it coming too late?
Again, Aditi ji, we can be a part of criticism, and one can say, no, it was your responsibility and you should have done it. With all humility, I'll say, yes, it's, yes, there's no argument to it. There's always if, but at the end of the day, you do make certain calculations. Now, whether that calculation was not being told to us or we could not anticipate, I can't really say, but it was never the intent of the government not to do it. Therefore, I had, as the investment minister, as the chief minister, Mr. Yogi Adityanath, the health minister, we decided, well, we are increasing so many beds, from where we'll get the oxygen. So can't we get an investment? Fair enough. The Inox was brought in Uttar Pradesh, invested in Uttar Pradesh. That's a big investment that we got it. If that is left only to us, perhaps the number of beds that we increased, they were all oxygenated, enough oxygen was available. So,
But you have to share
can't
that
really answer
oxygen
that
with other
question to you.
states. Yeah, but you have
I
to
can't
share
really
that
answer
oxygen
that
from
question, but
Inox.
it's never the intent
Yeah.
of the government not to, the number of beds that we increased by 3 times, yes, we had enough oxygen. Now, what looks to be the case is, we have to prepare, we are preparing for phase 3, that we have so many isolation beds, which is, as I said, 1,15,000 we created. Now, those more than 50% should have oxygen. Now, in order to have that number of oxygen, we are ensuring that these beds, oxygens are available within Uttar Pradesh. So, oxygen generators, through atmospheric oxygen, which is oxygen separators, all that has been being placed. So under private investment, 54 of them have been already ordered. Government of India is supplying. So we will have enough oxygen, and I hope it doesn't come through, that the phase 3 doesn't come.
Yeah, on a hope and a prayer, sir. But of course, unfortunately, as the second wave has shown us, that we can't really be
No, we should be
dependent
complacent.
on any hopes
No,
and
absolutely
prayers.
not.
Yes,
Yes.
absolutely. In fact, it was predicted that Uttar Pradesh will start seeing about 1 lakh positive cases from May 5th, but that has not happened. In fact, according to
Well,
data
again,
released by
that needs to be understood. Okay, why? Now, what we did it when we were given these figures, we immediately went to the drawing board. The chief minister took that under his control with his ministers and also the bureaucrats and also a panel of health specialists, that doctors. He has a own panel of almost about 12 to 13 who keep advising him, apart from his team 9. So now from there, what we did it, we said, let's enter where it will rise, urban or the rural. So we start preparing for the rural. We said, no, it will not be urban. So we went to the rural part of Uttar Pradesh. And one of the things I mentioned is, okay, let's create oxygen generators, oxygen concentrators in each community health center. We immediately went ahead and said, okay, we have Nigrani Samitis. There are surveillance committees in the urban as well as in the rural. Now, that's been ongoing, and as of date when I speak, we have actually contacted touch base. Out of 24 crore people, surveillance team has been to met and met them and tried to find out who's unwell, not well. All those things is about 16 crores. It's a large numbers that we did. But we started from 5th of May. As of today, we started a campaign which is like a Dastak Abhiyan, going door to door again by the ANMs, Anganwadis and the health workers and also the Pradhans, because now the Pradhans new Pradhans have been elected. They're part of the team. They go there. We have given them 10 lakh antigen test kits, also toolkits 10 lakhs, and also then they're going and aggressively testing. So, for example, like yesterday, I got the figure for yesterday. Yesterday, in entire Uttar Pradesh, rural belt of Uttar Pradesh, this aggressive surveillance system, we were able to reach out to almost all the 75 districts, that is 97,000 revenue villages. We have Gram Sabhas, we have 97,000, and through 70,000 of these surveillance teams, they reached out and we detected yesterday about 1,600 people were negative through antigen. Now, we have a rapid response team that's been immediately put in place. They have contacted now that village or that belt or those number of houses. They are now being conducted with a door-to-door proper testing is being done and being ensured that nothing, or those who are there in the community, they all are safe.
So you are pointing out about effective COVID management by your government, but which has been able to put a lid on the numbers. But your critics in the opposition say that the real numbers are being underreported. Testing is not as much as it should be. You'll be getting reports every day of people succumbing to COVID-19 from various districts of Uttar Pradesh. 700 teachers have been reported dead during panchayat elections. Yesterday, we saw some heartbreaking visuals of dead bodies floating in the Yamuna in Hamirpur district. Now, some are even saying that the sheer number of COVID-19 casualties in villages is, the rivers have turned cremation grounds. Yes, please.
Aditya, they are the same opposition people who are ruling in various other states also. Now, what they are trying to say is, UP is bad, wahan sab theek chal raha hai. Whether Chhattisgarh, Punjab or Maharashtra. So people they don't realize is that these number of these states are responsible, their opposition ruled state, not BJP ruled state, are responsible more than 60% of the COVID cases. So those who are criticizing must introspect also. It's not the time to join this criticism bandwagon. Rather than we all come up together and say, okay, Maharashtra needs this, we will work. If UP can serve them, we will serve them. If Maharashtra has a problem, they are sending, the migrants are coming. Are we crying about it? Number of migrants are coming. We are solving that problem. The last COVID-1, how many migrants came to Uttar Pradesh? There were 40 lakh migrants. When they came here, we realized they need to be given ration. We arranged ration for them.
Fair enough, sir. So criticism
through Manrega, through Manrega,
yeah.
we have now that in place proper. We, as a minister for MSME, we arranged skilling of those people. We realized, we mapped their skill and gave them certain jobs in Uttar Pradesh itself, apart from Manrega. So these are the things that the government, when you are in government, you need to understand that these unplanned challenges will come. You cannot be shouldering by saying, oh, the center is doing this, oh, Maharashtra is doing, or Punjab is doing. I should be crying about it also, that Punjab is sending the migrants, or Rajasthan is sending the migrant, and Maharashtra is also sending the migrant. We are not saying that. So,
okay,
it's their approach, not our approach in BJP.
Yes, but fair enough, sir. But the fact also remains that what do you have to say about the misreporting? Because let's just even look at the numbers.
I don't think so. There's a three-way reporting in our systems. So if all three are speaking the same thing, it is absolutely impossible. The Lucknow command and control system to control all the hospital, whether it's the private or the government, the data is going on the portal, at the district level. From the district level, it comes to the Lucknow. So all that it's a three-way. It cannot be that you can go on wrong on reporting. It's a portal, and once you load on the portal, if you are a hospital in charge, a private person, you load on the portal. I cannot change that. I have no capacity to change that. So it can be always, it's open for, it's absolutely transparent. So I will
So
not get into
what I
the
hear you
debate
say,
of,
right, sir? So what I hear you saying is that yes, there is a surge. Yes, the numbers are higher. Yes, we are trying to cope, but the numbers that the number of deaths or underreporting, misreporting that the opposition is claiming and that his critics are claiming is not correct. Is that what you're
well,
saying?
you see, problem actually, how does it begin? When you start vaccinating, the opposition comes up and says, "Arey, vaccine क्यों कर रहे हैं?" In Uttar Pradesh, they say, "Oh, we will not give." Mr. Akhilesh Yadav comes up and say, "Oh, we will not give BJP vaccine." Now they say, "Oh, vaccinate क्यों नहीं कर रहे हो?" When America refused to give the raw material for the one of the for making the COVID vaccine, they said, "Oh, look what America has done." Now they criticize, "Oh, why the government of India is taking the help?" So opposition is a little confused lot. They don't know in a consistent and a constructive way to criticize or attack the government. They cannot be changing the goalpost every time and say, we will not, vaccination should not be done. Now they say, oh, it is important, it's a life savior. These are changing the goalpost. Why
I
does
just have
opposition lead? Yeah.
Fair enough. I have just one question more, and then I will move on to what your plan of action is in, because the spread is now happening in rural areas, and what the UP government is trying to reach out to the rural areas and for increased vaccination, the vaccination drive that you've started for vaccinating everybody above a certain age. Now, but I want to really, before I go there, I just want to talk about the 700 teachers who were reportedly dead during the panchayat elections. That COVID restrictions could have been enforced more in a much better and more systematic manner. Do you feel,
Well,
and the visuals that I'm talking about yesterday that we saw from and in the Hamirpur district, people being left, people being actually disposed of, floated in the river as cremation ground. I mean, those are visuals that you really can't get rid of in your mind, and it pains your
well,
heart to see that happening. And I'm sure it pains your heart too, sir.
certainly it does. But let me pay. As I said, there is over-reporting on the. Well, it's so unfortunate. So I really don't know. One death is a death. Even one teacher is dying. It's
Absolutely.
unfortunate. So why get into the numbers with me? And I, as a minister, I hate to get into the numbers. But certainly, it's not the right reporting. But whatever it is, it's unfortunate. We all had to go through the entire exercise of the panchayat elections. The best could have been that no, the panchayat elections may not happen, but then the entire matter went twice to the High Court also, and once before the election started and once in between. Well, we all bow down to the High Court decisions also, and with certain restrictions that yes, they were announced, but yes, I have seen the visuals that many did not follow those protocols, and they were certainly not what the government wanted, or the police administration or any administration were asked not to get followed. Yes, they were followed. They were being asked, and they were strict. And number of places, whether it's Bijnor and other districts, number of cases have been filed as FIRs have been filed. So action has been taken by the government. So now to say that only the BJP fought the elections, I'm so sorry. Everybody fought the elections. It's once elections are announced, and then everybody follows that the process. So everybody did follow, and it is never the government which can stop the election process. It's always the election commission, or then there is a different way. Is the courts can all? I presume the courts can.
Okay, so what you're saying is that it's not really the government which is to blame. I mean, there is a point where the
I
government
will
could have
never
come in.
say whom to be blamed. It will be foolish on my part to say that don't blame us. We are the government. Certainly, we are the
Yeah.
government. But it's not that we were not doing. if to say that the only way is, okay, if the people are still, attending too much of marketplace or going into a common place, and they're still not following the protocol, the best thing the government can do is put a lockdown then. Now, who puts a lockdown on an election process? I think you as a journalist know better.
Right. Let me just move on to what's happening in the rural areas of Uttar Pradesh. The virus is spreading there. There's no doubt about it. What plan has the state government put in place to control and manage the pandemic spread in rural areas?
Well,
Because that is a fear
as I
factor.
said, we have these Nigrani Samitis, which are working as a surveillance system, and we have reached out in urban and rural about 16 crore people out of 24 crore, and that's one of the reasons when we are saying that tracing is being done aggressively, then the testing, and then the treatment. So when we are doing this from where we started in about 3.5 lakh cases, active cases. Now we are down to almost 2 lakh active cases, and drastic, positive results are being noticed in last 10 to 15 days. We are making at the same time, we are making arrangements in the community health centers with 2020 oxygen concentrators. We are engaging our rapid response team, which is more available for the rural part of Uttar Pradesh, and we are also encouraging people to come for vaccination. Rural centers have been created in each block, which wasn't the case. Now we have got within the block also vaccination centers with proper cold chain and the doctor and ANMs to follow the process as per the protocol. So all these things put together is definitely helping Uttar Pradesh, and I would certainly say rural Uttar Pradesh was always a concern for us, but perhaps we took the right call at the right time when we were sounded about by the center that maybe UP can go up to 1 lakh by first week of March. So it came as a warning. So that entire exercise went in. It has shown results, and with certain restrictions. I won't call the lockdown, but there have been certain restrictive lockdowns in Uttar Pradesh. So the results have been encouraging, and today our positivity rate was almost about 16%. Now we are at 10%. So hopefully in a week, because we have extended the restrictive lockdown for till about 17th of May, we should be now then around 6 to 7%, and further improvement should come in Uttar Pradesh, and we won't see any more of our peak, and the time then will be available to introspect further, do more better planning, and not to do firefighting and be better prepared for the phase 3. But again, then the big question comes, what is phase 3? We don't know.
And also, we are not sure at this time. But let me talk to you about Chief Minister Yogi Adityanath's announcement that the vaccine for 18 to 44-year age group, which started today, I believe, in 11
no, we started
districts.
On the 1st of May. No, we started on the 1st of May.
Okay, you started
now,
on 1st of May.
We have got 18 districts where it has been launched. Earlier we launched with 10 districts. Now we have 18. 8 more have been added.
Okay, so but everybody has to register online via the COVID portal or the Arogya Setu app.
That's right.
And register for vaccination. But the problem is exactly that, sir, isn't it? Many people in rural areas without access to smartphones, how do they register? I found it difficult to register myself. You're sitting here.
I can't really say.
Is there a different? But is there a different strategy that is needed nationally to improve India's vaccination drive in rural areas rather than depending on apps?
Well, I should have covered when you asked me what you're doing in the rural. I forgot about. When in the rural area, when the people are going and we find those who have not been vaccinated and below 44, 45, then we are ensuring through Pradhans and our other members who are part of that committee that they get enrolled for vaccination. So a number is being generated. So those who are not savvy, which I would say 50% may not be, but who are youngsters, But that's also a now rarity in India, when at least with the smartphone, because it's a Hindi version is also there for the registration. They can do it immediately. Otherwise, the help is being given to them.
Okay, the help is being given to them. And what about vaccines themselves? The entire
Well, it's a
country.
supply. Again, it's a supply chain.
Yeah, the entire
We
country is
well,
struggling with the vaccine shortage. What
well,
about UP? I mean, you have the
we
highest
have two of
population.
them. Well, the world is struggling with the vaccination. Number of vaccines being made available. So
Yeah, but many countries have
there's a
already
supply. We
vaccinated
must
themselves,
understand the
sir. But
supply chain is there. We are lucky that we have two, and we should be proud that we have two manufacturers in this country who have been, supplying, the vaccines. And but we need, as the country is opening up to the entire population, we need more vials. So in Uttar Pradesh, apart from these governments 50%, which comes for 45 plus, which comes to the government, central government, the balance below 45, we are now procuring from these two suppliers, who are the Serum Institute, and also the Covaxin supplier. And also we have taken out a tender, a global tender, for 4 crores vials, and those who have been approved by ICAMR, which are about 5 of them now, or 4 of them, they all will be now closing. Our tender should be closing in next 4-5 days. So we will be getting that quantity that can be imported, and we will be importing directly as a government, and then vaccinating those who are between 18 and above till 45 in a more aggressive manner.
okay, the partial curfew, it was the time that the vaccines come. The partial curfew that you've imposed in the entire state now, which has been extended till 17th of May. Are you relying on this lockdown to break the chain of the virus and gear up your healthcare system to deal with this ongoing second surge in the meanwhile?
Well, we haven't, as you said, it's a partial only, because we feel the livelihood needs to go on, because they are daily wage earners also. They need to, have their livelihood going. So, and then there is many industries needs to go around, but mostly it's quite closed. Those the market areas are all quite closed. They are restrictive essential commodities like that. We have it. So we have extended till 17. We do feel there are benefits of balancing this life and livelihood, and due to that, one of the reasons I would say is a partial lockdown is also helping in breaking the chain. And with our other things which I mentioned, this particularly the surveillance system that we have put in place, and with the vaccination program that we have in place, I think we should be able to break this cycle of COVID in Uttar Pradesh. By end of May, we should be in a much better position.
By end of May, much better position. You're saying you've done all you could, and the situation could have been far worse had the UP government not intervened and made all these. But as you're pointing out, the situation is still untenable, and but you're trying to cope with the rising numbers. One last question before you go, sir. The 2022, the assembly elections next year. Do you believe it to be, will it be a referendum of UP government's handling of the COVID crisis,
I
considering?
can't really say, but trust me, many have asked me this question. But in government, at the chief minister level, our levels, or the party levels, which we are really not thinking about it, the 2022. Certainly when it comes, we have to think about it. We can't run away from there. But I think we feel, if we are honest, we are sincere, and we work hard, and we keep serving the people with that intent, we keep moving, then God is always with you. And why not? During the elections, the God are the voters, so they will be with us.
Okay, you feel that the voters will be with you. In the meantime,
But
thank
we
you
need
for
to work.
joining us. Yeah,
We need
I'm
to work
saying
for it.
that the situation could have definitely been, the situation right now is also no rosy, green park. It still is a very precarious situation. I live in Noida, in Indirapuram, actually, Ghaziabad. So I live here, and I see a lot of people.
Again, since if you give me a minute, 30 seconds,
Sure.
you see what we are noticing here is that certain cities, for example, when all this started in March, Noida and Ghaziabad, then whenever the hotspots, as cities, we now realizing that like we are improving in, for example, Prayagraj, Varanasi, Lucknow, Gorakhpur, things are improving there. So we feel that things are, getting little severe in all these cities. But particularly, we now see the easing happening in Noida. We are seeing the numbers of cases coming down in Meerut. So like that, we are noticing also. Again, a lot of things have to be put in place, which we are putting. So we hope. Therefore, I said by May end, things would be better. So don't worry. The government is looking at it, and we are working tirelessly to serve all the people who are staying in Uttar Pradesh, irrespective from where they come. We are for them. We will address this issue.
All right, thank you. That sounded like a real slogan towards 2022. Really, although you're saying you're not thinking about it right now. But thank you, Sidharth Nath Singh, for joining
Thank
us
you very much.
and giving us a status update on the COVID situation in Uttar Pradesh. He, of course, accepts that things are not very good, but the government is trying very hard, is what, and he's enumerated a whole lot of things that the government is trying to do. Thank you so much, sir, for joining us in
Thank you
this
very much.
broadcast today.
Thank you.
We'll keep coming back to you with more. Keep watching HindustanTimes.com.